I'm always happy to advertise and promote and invite and to an event and have people show up.
Yeah.
And how many of you, the night of the party, about half an hour before the party, you know nobody's going to show up?
Oh yeah, that's.
Yeah. So thank you all. I know you have a lot of options and a lot of ways to spend Saturday morning, and so we appreciate you spending it with us. So let me tell you how we're going to do this today. First of all, there are two bathrooms. There's one right back here. While people are talking, we prefer that you go out those doors, and there's another bathroom right outside those doors. There's plenty of coffee, there's plenty of food, there's water back there. Feel free to help yourself. So this is how the program's going to be. I'm going to talk for a few minutes about my part in it and my husband's adventure with dementia. And then Ernesto is going to talk about how he helps people through evaluations and treatments. And then Michelle's going to talk about nutrition and the important part that plays in the whole process. So is that okay? Does that sound good?
Yeah.
Yeah, okay, good. My husband was, first of all, I'm Joan Stutz. I'm with Transamerica World Financial Group. I help people plan for retirement with dementia or without dementia. Now, so this is the last part of this. Today we're going to plan without dementia, and you're going to die after a dance at age 102. Yes?
Yes.
Okay. But in case you end up with dementia and have to be at a nursing home, then I can help you with that too, because we offer long-term care programs that will help, did you hear that? Help with the expenses. One of my friends has a father who is in what they call stage 4 Alzheimer's. At the terraces, $14,000 a month plus $2,000 a month additional for personal care. So if you do end up having dementia or Alzheimer's, it is a very serious medical, financial problem. One of my friends has a mother who was diagnosed with Alzheimer's almost 20 years ago. She has gone through a multi-million-dollar fortune being cared for. So when I looked at Earl, my husband of 28 years, and found out that he could no longer make coffee, or warm the coffee, or make toast, I panicked. And I grabbed him and I said, Earl, we have to do something because you are not going to die soon enough. He was sent home to die 7 years ago. He was supposed to die in 6 months. So what do doctors know, right? He has a leaky heart valve, but somehow it leaks in a way that's okay for him. But the end result was that he was diagnosed with dementia about 5 years ago now. Lost his driver's license 4 years ago. He's still mad at those damn doctors that took his driver's license away. I was so grateful for those doctors because it was no longer very safe to drive with him. And those are the things that go on. So when I realized that he was headed for a nursing home, and how did I come to that conclusion? First of all, he was pretty dysfunctional around the house and maintaining himself. And he was sitting and staring for long periods of time. So we had to do something. I had met Dr. Ernesto about a year earlier, and my one regret is that I didn't immediately panic and run down and get him evaluated. So that started in March. February, he was fairly dysfunctional. We started in March doing the supplements and the exercise and the diet program that was recommended. And even at the end of, when I left with my little bag of vitamins and stuff, I said, when can I expect some results? At 90 days, oh shoot, I have to dish out vitamins for 3 months, and maybe you'll see something. Probably 6 months. Okay, at the end of 90 days, at the end of 30 days, I was seeing improvement. At the end of 90 days, he was making coffee using the microwave and finding his TV channels. Yeah. If you think it's fun living with someone that can't turn the TV on and find the right channel, you are wrong. That is no fun because they're so dependent. So that's kind of why I'm here. If I heard this story and had not lived it, I don't think I'd believe it. But because I lived it, I'm eager to share it with you, and I can tell you that it worked for us. Will it work for you? I don't know, but it has worked for a lot of people, according to Dr. Ernesto's investigation education. So I'm going to invite him up here. He has his degree in psychology. Then he got brave and went to chiropractic school. Then that wasn't enough education. You know how some people just want to keep being a student? And he'll tell you about why he chose to go into functional health, specializing in brain health. So please give a warm welcome to Dr. Ernesto Medina.
So thank you, Joan, for that introduction. I'm just going to start my timer here so I don't talk all day. So the actual reason I partnered with Joan and Michelle is because they both offer a lot of huge experience and clinical education in areas, Joan especially in finance. One of the biggest issues that I was having with trying to communicate to these patients and their caregivers and their family members was how much they were going to have to spend once their loved one got to that point of needing 24-hour care or needing to be in a 24-hour memory facility, which, like Joan said, can cost anywhere from $10,000 to $14,000 a month. And they weren't realizing the financial implications, because one of the biggest advice that primary care doctors and even neurologists give is, let's just wait and watch. Let's wait and see what's going to happen. And all they're doing is waiting and watching till the inevitable happens where they need 24-hour care. And that waiting and watching time is the most important to act, because you can change the course of that disease, you can slow the progression of that disease, and in some cases, reverse it. Okay, we're going to talk about why that is. So my name's Dr. Ernesto Medina. I am a chiropractor, but I have postgraduate training in functional medicine and functional neurology. And I did that because, well, first of all, who knows what functional medicine is? All right, like half the room, awesome. I always ask that because most people don't know what it is. So functional medicine is essentially a term used to describe healthcare providers who are trained in identifying the root cause of chronic disease instead of just medicating a symptom. For example, I have a big set of patients who have been coming into me this last couple months who are all diabetics, type 2 diabetics. They're being medicated, they're on insulin, and they've been being medicated for years, and their medications are not working at controlling their blood sugar, or they're having so many side effects that they refuse to take the medication. So what do? We identify the underlying root causes contributing to the diabetes. So we assess their diet, their nutrition, their sleep habits, their exercise habits, their stress levels, and we work at improving those, and guess what happens? Blood sugar comes down, diabetes gets better, or whatever it may be, high blood pressure or high cholesterol. Okay? So that's what functional medicine is. It's a very proactive model of healthcare. It's not reactive. We're all about identifying early signs and intervening right away instead of waiting and watching. Okay? So my personal story, the reason I got into this is because growing up, one of my biggest mentors who did a lot for the community got diagnosed with Parkinson's disease at about age 50. And being that he was young, very young, and being that he worked in healthcare, he had access to the latest drugs, the best doctors, the best neurologists, and still nothing helped. And I watched him progress through the disease over the years, and it is a terrible, terrible neurodegenerative disease, just like Alzheimer's and dementia is. Okay? So it wasn't until I was in chiropractic school that I realized there's an amazing amount of research that exists that shows that there is a lot that can be done outside of the conventional medical model to help these degenerative brain diseases. And that falls in the realm of nutrition, diet, supplementation, exercise. An amazing amount. But again, that falls outside of the traditional medical model. So it's not talked about very often. So basically, we developed these free workshops here because we have a problem in the healthcare system in the United States. We're living in a failing healthcare model. About 6 million women today suffer from infertility. Cancer rates for women right now are about 1 in 3 and about 1 in 2 in men. Okay, they can't get much worse than that, right? Yet $6 billion is spent in research for cancer, yet none of that money is being spent in identifying what's causing it and why people are getting it so young. And it's getting younger and younger. 1 in 6 children has a diagnosed developmental or learning delay today. And currently about 1 in 3 seniors show signs of Alzheimer's disease in the brain on autopsy. All right? And it gets worse. The growth rate of autism and the growth rate of Alzheimer's are both growing at an exponential rate, and there's no explanation why, and there's no plan of action to try to improve that. So today, about 1 in 36 girls is diagnosed with autism, 1 in 28 boys. In the 80s, it was about 1 in 10,000, 2000, 1 in 150, 2008, 1 in 88, and in 2012, 1 in 68. And today, 1 in 28 boys. Okay? And yet the CDC will have you believe that it's not really getting worse. And it's the first time in history where the youngest generations are expected to have shorter lifespans than their parents and grandparents. Not very promising future for this country. So a quick overview of today. We're going to be talking about why conventional medicine and the conventional medical model is failing in brain-based diseases. In fact, I think the 2 biggest areas conventional medicine fails is brain-based diseases and autoimmune diseases. We're going to talk about the latest and greatest info on maximizing brain potential and how to actively prevent brain degeneration starting today. So quick disclaimer, like always, this information is for informational purposes only. It's not meant to diagnose, treat, or anything like that. But that being said, the info I'm going to tell you here today, likely your medical doctors don't know about. And then we're going to talk about why. So usually I do a little memory test, but I'm going to skip this for time's sake. I gave you all a little handout, a 1-page handout. At the end, what I'm going to do is I'm going to take questions, and you can spend some time filling that out. That questionnaire is a short, takes about 3 minutes, and it's a list of common signs and symptoms of poor or low brain function. Okay, so if you fill that out and mark a lot of yeses, say 3 or 4 yeses, that's a warning sign. Okay? So I'll give you some time later to do that. So current statistics on Alzheimer's today. It is probably the fastest growing disease in the history of the United States as far as the amount of people who are getting it, who have it, who are dying from it, and who are expected to get it in the next 20 years. The fastest growing disease. At the time of making this presentation, which I made it almost exactly a year ago, it was the 6th leading cause of death in the United States. This year it is number 3 now. Okay? And questions at the end. Be sure to save it. And I believe strongly that in the next 10-15 years it'll be number 1. The majority of people who get Alzheimer's disease are age 65 and older. However, we're going to talk about later that when you have Alzheimer's, usually that disease has been around for 10, 15, even 20 years prior. There are no known effective medical or pharmaceutical treatments that exist currently. Like I mentioned, if you're lucky enough to get diagnosed early, you're told go home, come back in a year, we'll watch it, let's wait and see what happens until the inevitable happens. And current research funding for finding drugs is headed in the wrong direction. Very wrong. In fact, drug companies are giving up. All right? Every single drug, when it goes through trials, costs about $500 million. To put it onto market, another $500 million. Very expensive. And this article came out in January of 2018. Basically, Pfizer, one of the biggest pharmaceutical companies around, fired about 300 employees of their research and development area dedicated to finding drugs to Alzheimer's and brain degenerative diseases. They fired them because they were getting nowhere and it was costing them too much money. Right? And that has kind of been the trend with pharmaceuticals and brain degenerative diseases for the last 10, 15 years. So the current medical standard, this is what happens today. The understanding is that Alzheimer's disease is a progressive disease with no known cause, no known treatment, and no known prevention strategy. That's why the advice given is to wait and watch with no advice given, no proactive advice. Now, I like to give the example. When you go see your doctor and your blood sugar is high, what happens? What does your doctor tell you? You need to change your diet and you need to exercise or you're going to get diabetes, right? But nothing is done when you're diagnosed with early cognitive decline or early memory loss. Nothing is said, nothing is done, nothing is advised. You're told to go home and let's wait and watch. The other problem is there's no proper brain assessment tools. There are standardized written tests that they do for brain assessments, but they are largely insensitive, which means you can have mild cognitive decline and show early signs, but you'll test normal on those written exams. So here's the latest and greatest information on brain health coming out today. Alzheimer's disease is a progressive but inflammatory, emphasis on inflammatory neurological disease. And it comes about due to a relationship between your genetics, the environment you live in and are exposed to. And by environment, I mean the air you breathe, the water you drink, the foods you eat, and the medications you take can influence the course of this disease. And your history of concussions and or head traumas. Okay, so football players, soccer players, hockey players, they are not the only ones. The most common way people who are not involved in sports experience a concussion is through a motor vehicle accident, a whiplash accident. Because what happens, you get rear-ended, the seatbelt locks, your head flies forward and back. Even if you hit nothing, your brain is going, right? So, that's why it's common for people to experience PTSD, anxiety, depression, mood disorders, sensitivity to light and sound after a whiplash accident. Okay? I like to say Alzheimer's disease is not a disease of the brain per se. It's a disease caused by failure of the multiple systems that feed and protect and nourish the brain. Right? When those multiple systems fail to feed and protect the brain, the disease presents itself in the brain as Alzheimer's. And then we have this thing called the brain-gut axis. Has anybody heard of this brain-gut axis, or the brain-gut connection? Yeah. Basically what this means is, latest research is showing that our digestive tract tissue is derived from the same tissue our brain is. And we have a direct connection from the brain to our digestive tract through a nerve called the vagus nerve. And they communicate with each other constantly. And it's a bidirectional pathway, which means the foods you eat, if they mess up your stomach, they're going to mess up your brain. Right? If you have a bad brain, it's going to mess up your digestive tract. So you cannot have a healthy one and a bad other because they will feed into each other and destroy each other. So when we have treatment programs around things like Alzheimer's or degenerative brain diseases, we focus on the gut and we focus on the brain. So when we eliminate inflammation, we can heal the brain. When we minimize risk factors, we can heal the brain. And when we exercise, we can actually grow new neurons, new brain cells. One of the trademark signs of progressed Alzheimer's is that the brain shrinks, brain tissue dies. But now we know exercise can actually create and grow new brain cells. Right? So this is a picture I took from a study, basically linking inflammation to a number of different chronic diseases. So we got diabetes, cancer, cardiovascular disease, Alzheimer's, arthritis, autoimmune diseases, and neurological diseases. The hard part is identifying what is causing the inflammation. That is my job as the functional medicine doctor, and it's also probably the most complicated part. There can be multiple causes, we're going to talk about them later, but we try to identify as many as we can and eliminate or minimize their negative effects. So what does this mean? You want to go back? So what does this mean? When you minimize inflammation, when you exercise, when you feed the brain what it needs, what happens? So this book was published by a medical researcher. This book was published last year, called The End of Alzheimer's. And basically, his research showed that he was able to reverse all the symptoms associated with Alzheimer's disease in 9 out of 10 people. Okay? Yeah. They just published a follow-up that came out last week where they did it in 100 people. And it was all using this same model of healthcare. Really good book, I recommend it. I've heard that they sell it at Costco, but you can find it on Amazon. You can check it out afterwards if you want to see more about it. So, this is an article that came out in 2011. This was out of UCSF Medical School and the VA hospital. Basically, they stated 50% of Alzheimer's cases are preventable with lifestyle changes. 50%. I told you earlier that it is the fastest growing disease in the history of the United States as far as the number of people getting it and expected to die from it. But this is huge, knowing that 50% of cases are preventable. And the lifestyle changes they looked at were smoking, lack of exercise, depression, diabetes, midlife high blood pressure, and obesity. All right? And that's just those risk factors they looked at. When you actually look at the full picture, like functional medicine doctors do, I would say it's even higher than 50% preventable. Mm-hmm. This is another article that came out in a psychology journal, basically linking low cholesterol to poor brain health, depression, and suicide. Right? So a common thing done in the conventional medical model here in the United States is to lower cholesterol, because low cholesterol is healthy. It's heart healthy, right? And that's been the motto for the last 60 or 70 years. However, this article is showing that low cholesterol is linked to Alzheimer's disease, depression, manic and depressive episodes, bipolar disorders, and violence. Alright? So, it's not to say that cholesterol should be like through the roof, but we need healthy enough levels of cholesterol because cholesterol is the basic building blocks to hormones. So, estrogen, progesterone, testosterone cannot be made without an adequate amount of cholesterol. Okay? And for women especially, I think I had it on one of my slides earlier, 70% of Alzheimer's cases are women. And one of the big issues is when women go through menopause, if their estrogen levels tank below acceptable limits, they can have immediate onset of dementias or memory loss. Alright, so practical take-home tips. Have a cognitive assessment done. Now remember I told you, they're not very sensitive, the ones that exist. However, I have access to a computerized, standardized cognitive assessment test. I'm offering this through my office, through a really cool deal. I'll explain at the end. But starting about age 40, okay, remember, there are no recommendations for getting your brain integrity tested right now. But we're recommended to get colonoscopies, right, about age, 40. Women are recommended to get mammograms, right? But we have no recommendations to get your brain tested. So I recommend, starting at age 40 or younger, if you have a history of head traumas, come in, do the assessment test, find a baseline of what your brain function is today. That way, in a year, 2 years, you can come back and retest it, and you can find out how your mental integrity is and how efficiently it's aging, okay? And if you have a family history of Alzheimer's, there's a genetic test you can do called an ApoE4 genetic test, all right? Early warning signs, like I said, can be present 10, 15, even 20 years before memory loss occurs. And they are depression and apathy, brain fog and brain fatigue, chronic unresolved constipation. Remember, because of the link between the brain and the gut. As the brain starts to fail, the digestive tract starts to fail, you can have indigestion, bloating, gas, constipation, all kinds of digestive issues from a brain-based problem. And the loss of smell. So the loss of smell is probably one of the earliest signs, and that's specific to the smells of peppermint, anise, and coffee. Those are the 3 big ones. In progressed stages, like for Earl, for example, we've been having a lot of difficulty getting him to eat and eat consistently, because when you lose the sense of smell, you lose the sense of taste. Food has no flavor anymore. Everything tastes the same, which makes it very difficult to have an appetite and to get food into his system. Right? Sources of inflammation. Okay? Oral infections is a big one. Okay? If you have untreated tooth issues, if you have infected nerves, if you have root canal issues, they need to be addressed, because those infections get into the bloodstream and go straight to the brain. They can go to the heart as well. Viral or bacterial infections in the digestive tract. Right? And I would venture a guess most people have undiagnosed infections in the gut. I've done about 15 stool tests in my office to check for this, and only one of the 15 did not have infections in their gut. Pesticide or herbicide exposure, so eating organic. Michelle's going to expand a lot more on that. Lack of essential vitamins and minerals, so iron levels, B vitamin levels, magnesium, vitamin D, and your omega-3 levels. Very important for brain function. No cholesterol like we talked about. Lack of fat in the diet, and that's healthy fat. Michelle's going to expand a lot more on that, but healthy fat is vital to brain function. Too many carbohydrates in the diet, very inflammatory, and that's refined processed carbohydrates. Diabetes or unmanaged prediabetes, and food sensitivities. So food sensitivities are delayed allergies. They're not immediate allergies. Allergists do not test for this. Okay, I have this discussion weekly. People go to their Kaiser doctor, oh, they're going to test me for allergies. That is not the same as food sensitivities. Completely different. They don't even offer that test at Kaiser. So strategies to implement, take home, right? This is the take home right now that you can implement today to protect and heal your brain. Sleeping 8 to 9 hours a night, vitally important. The immune system cleans out garbage from the brain at night when you sleep. Eating good quality organic foods. Intermittent fasting. Who's heard of intermittent fasting? Awesome. There's 100 ways to do it. Not every way is best for everyone, but very beneficial to the brain and the immune system. And the use of ketones and MCT oils also can be very beneficial. A healthy fat diet, high intensity interval training. Who's heard of high intensity interval training? Nice. Basically, high intensity interval training is when you do an exercise at high intensity for 30 seconds to a minute, you rest for a minute, and do it again, and then you rest, and then again. And you do that for 10-15 minutes. A good quality multivitamin supplement, preferably whole food based. Michelle will expand more on that. And supplementing omega-3, DHA, turmeric, magnesium, vitamin D, all essential, and almost all the population in the United States is deficient in them. All right? So take home message, do not wait and watch an early diagnosis. The sooner you act, the better. If you suspect something might be going on with your brain, fill out the questionnaire, come in, take the cognitive assessment I offer. Early warning signs can be way early, 15, 20 years. right? And get evaluated by a functional neurologist or a functional medicine practitioner. These are databases with trained doctors who are trained the way I am. You can find one in your location there, all right? So, a cognitive assessment that I offer in my office, basically the deal is for 99 bucks, you can get the test done. That is the cost of the test. I donate my time to you to review the results, assess other risk factors, and you take home the results with you. All right, thank you very much. Questions? Yes?
So you mentioned a lot about US. Is it specific to US or you haven't reached global?
Alzheimer's?
Yeah.
So it's #1 cause of death in the UK. Yeah, so it's largely a disease in developed countries.
Because?
There's a lot of speculation.
Is it the food processed?
What's that?
Is it a lot of processed food?
That's part of it. A lot of processed foods, a lot of pesticide use, a lot of medication, over-medication, over-vaccination. Who do I see? Yeah, go ahead. Go ahead.
Oh, I just had a quick question about, like with 23andMe genetic testing,
Yeah.
they say that they can find your food sensitivities. Do you read those results, or can you use those results, or are those even worth doing?
To be honest, I have not seen a 23andMe one, but those are all genetic tests, right?
Yeah, but they tell you, like, I got an email saying, you know, or my friends get emails that you have a gluten sensitivity that they may not have known about, that other doctors
That's based on
miss.
genetic testing, yeah. I don't think that's as accurate because it's highly dependent on the status of your intestinal tract at the time. Food sensitivities can change
Okay,
based on exposure.
okay.
So if you cycle through foods periodically, your exposure is lower and your tolerance is better to those foods. But there is a blood test to check what you're sensitive to at this moment.
Okay.
Yes.
So, what are the differences between Alzheimer's and dementia? Because my mom has dementia.
Yeah, good question. Dementia is a general term. Alzheimer's is a type of dementia. 80% of dementias are Alzheimer's,
Okay.
right? So dementia is just a broad term.
Okay,
What's the
but the
difference?
same kind of things that you're talking about will help with that as well.
Yes, absolutely.
But you're saying this is not that, this $99 thing is not for, what is this not for DX dementia mean?
Oh, so that means, basically this means if a person's already been diagnosed with Alzheimer's, so progressed Alzheimer's, this test is difficult for them to do. This is for people who are early onset or suspect something may be going on, or you're healthy and you just want to create a baseline. Yeah. I have other simpler tests that are done for more progressed cases. Yes.
I have a cousin that's way into, well, definitely dementia. I've heard that they said something about Parkinson's. Could she be helped? I mean, both of her parents actually had dementia, and we kind of knew that she was gonna have it, and she's big time. And actually, we're like feeling really bad because we want to do something. Of course, it's the family
Yeah.
deciding everything.
That's a tough question because there is a point of no return, right? When that disease becomes progressed enough, there's not enough brain tissue, there's not enough integrity there to build on, and there's no return from that. That's why early identification, early intervention is the most important. In Earl's case, he was actually stage 5 of 7, I think, 4 or 5 of 7, which is fairly progressed. I was amazed we got that much improvement from that, right? So I'll be around after if there's any more questions. We're gonna go on to Michelle's, but we'll hang around afterwards, right?
Okay.
Don't forget your questions.
Okay, big round of applause for Dr.